The autonomic portion, I don't know why I drew a line on it, is involuntary. So things like the heart, the rate of the heart, things like the respiratory rate, things you don't really have control over, that is all directed by these nerves. Then the autonomic is further subdivided into two sections. Sympathetic and the parasympathetic divisions. Sympathetic is what we call fight or flight. Fight or flight. The parasympathetic is what we refer to as rest and digest. Most of our lives, we live in this. Most of our lives, we are under parasympathetic control of the autonomic nervous system. It's not doing it automatically. Most of our lives, we are here. That means when you're hanging out on the sofa later tonight with your best boyfriend, girlfriend, friend, and you're watching TV, watching a movie, and you're eating pizza, you're digesting that food, your heart rate is nice and calm, and your respiratory rate is nice and calm. And the digestive process is happening, processing that pizza with those cheese fries. Mm-hmm.
Well, you're hungry.
Your body's making urine just fine. Your eyes, your pupils are constricted, they're focused on what's on TV. Your body's ready for amorous activities. And then suddenly the smoke alarm goes off in the other room and black smoke starts rolling out from under the door. What happens to your heart rate? Because now we're switching over to this. We're switching into emergency reaction. We gotta either fight or flight. I prefer flight. Run away. What's going to happen to the respiratory rate?
They start breathing faster.
Yeah. Now, if we're running away, we're going to be using a lot more of those skeletal muscles, right? Or even if we're going to put up a fight, we got to use a lot more of those skeletal muscles. So if we're using a lot more of those skeletal muscles, they're going to need a lot more blood. They're going to need a lot more oxygen, nutrients, which is why the heart rate goes up, respiratory rate goes up. Blood that was going to the gastrointestinal system now gets shunted to the muscles. What happens to the pupils? Because we want as much information coming into our brain as possible so we can figure out the best escape routes. You totally forgot you had to pee. Because your body's switching over to this. But most of our lives we live here. Parasympathetic. Fight or rest and digest. Fight and flight happens when you're being chased by a bear.
Would it ever be a case where one of those are like lost?
No, I can't think of a case where a person does not have a sympathetic response. Even if they don't do anything, terror causes them to freeze, everything else still happens. Their pupils are still dilating like this. That stuff you can't. Okay. Health of my
What does PNS mean again?
peripheral nervous system. Everybody understand what peripheral means?
Because it's not.
Yeah, out from the center. And everybody understands it when you hear the term peripheral vision. Right? The central nervous system is central. It's right in the middle of the body, brain, spinal cord. Pardon me while I get an information device. is divided into 4 sections. The cerebrum, which is all of this part here. The cerebellum, which is this part here. The brainstem, which goes up to here. And the diencephalon, which is inside right about here. 4 major parts of the brain. And if you look at the brain, obviously the most obvious part is this big part right here, the cerebrum. Now, when you first look at a cerebrum, first look at the brain, one of the first things you're going to notice is there's lots of folds and grooves, or as we like to call them, sulci and gyri. Gyrus is a fold, a sulcus is a groove. So there's all these grooves and folds. And you'll notice that there's a big giant fissure, a big giant division that runs right down the center of the cerebrum. That divides the cerebrum into a right and left hemisphere. And just so you know, when you hear people talk about someone being right-brained or left-brained, they'll say people who are left-brained are more artsy, people who are right-brained are more analytical, or vice versa. Doesn't really make a difference because none of it's true. Both sides, both hemispheres, both sides do the same stuff. Different sides of the body, different parts of the body. So here's the front view, and you can see that fissure that runs right down through here. That's part of the brainstem here. This is the pons. Here's the cerebellum at the bottom. And I'll cut a little bit of the brain here for you. So let's take a little bit of this away. Now, you can see where we cut right here. If you turn on the brain, so you're looking at the front, we get this view. It's a good view because you see a couple of different things. First of all, you see this right here, the corpus callosum. And this is what is going to, help connect those two sides, so that information from one side can pass to the other and vice versa. Below that, you can see a couple of holes. In fact, you can see like 3 holes in the middle of the brain. There's one here, and there's one here, there's one here, and there's one behind, like right here. Those are called ventricles. It is in the ventricles where our brain makes cerebrospinal fluid. That is the fluid that circulates around the brain, that brings nutrients to the brain and to the spinal cord. That fluid is made there. You'll also notice that there are areas that look white. And then the outer areas kind of look gray, which is where we get the names white matter and gray matter. If you recall, when we talked about neurons, they had a body with then a long axon, and then the signal traveled from the body of the cell down the axon. And I said it had that insulation called myelin that caused that to leap, the exponential leap on down. That myelin insulation is actually fatty cells. It's wrapped around that axon. And that's what you see in white. All this white material is fatty cells wrapped around the axons of neurons. And all the gray areas, the bodies of the neurons with all those dendrites. Which makes it even more confusing to understand when you look at it this way.
It's wrapped around what?
The cells are wrapped around the axon of the neuron. Remember, the neuron looks like this. It has those branches coming off. Then it has a long axon. And I said the myelin is that insulation that we find sort of wrapped around here. So that's made up of fatty cells. And that's what creates that insulation so that signal can leapfrog on down and zip to the end quickly. So what you're seeing here in white is actually this insulation that's wrapped around the axon of neurons. Okay. I think that's everything I want to show you here. So go back to this image. Let's talk about the cerebrum. The cerebrum is divided into 4 sections on both sides of it. 4 sections. And if you remember the bones that make up the cranium, it'll make it a lot easier to understand where these areas are located. For instance, the frontal lobe. The frontal lobe is going to be located underneath the frontal bone. Parietal lobe, parietal bones. Occipital lobe, occipital lobe. Temporal, temporal. So here's what you want to know. What do these areas do? That's a good question. The speech center is located in the frontal lobe, as a for instance. So when I'm speaking to you right now, the sentences that I'm forming, you're making sense of in that part of your brain. It's comprehending what I'm saying in that part of your brain. And when you speak, it starts in that part of your brain, the frontal lobe. But here's an important thing about the frontal lobe. The frontal lobe contains an area called the prefrontal cortex. This is the newest part of our brain.
The what?
The prefrontal cortex. You don't have to write that down, just listen.
Yeah, it is
Just listen.
random.
Because this is important. The frontal lobe is responsible for helping us to identify the benefits and consequences of future actions. Helps us make decisions. It helps us to tell the future. Well, sort of. I'm going to get to that right now. Because that part of your brain is the one that says, should I go to college? Maybe go to law school? Become a lawyer? Be successful? Make some money? Or should I rob banks? Make some money? That's about it. This part of the brain makes those decisions.
The prefrontal.
Yes, just known as the frontal lobe, just the frontal lobe
That's right here.
in general. Yes. So in that way, it kind of helps define what you're going to do, what kind of decisions you're going to make. So in that way, it kind of tells the future. But it doesn't do it just long term like that. It does it moment to moment. So if you're walking down the sidewalk and there's a big chunk of sidewalk missing, a 3 foot by 3 foot square of sidewalk torn out, and there's a 2 foot hole there now. As you're walking along and you see this hole in the sidewalk, here's what you do. I gotta start back here because it's very dramatic. So you're walking along, I'm having a good day, there's a hole in the sidewalk, and you go like this, and you walk around and you keep going. That's what you do. Here's what you don't realize what you do or did. As you're walking along and you see this hole in the sidewalk, your brain sees this hole and says, I need to get from this point to that point. One option is I could step down into the hole and then step back out of it again. But in doing so, I could trip, I could get my shoes dirty, it's going to require a lot of energy. Another option is I could leap across the hole and come down on the other side. But that's going to require a lot of energy. I could trip and fall. That might not be a good idea. Another option says I could walk on this side of the hole, but that's going to put me closer to traffic, which could be more dangerous. Another option is I could walk on this side of the hole, which is gonna put me on this guy's grass, and he might not want me walking on this grass. But of all of those options, the best one is going around and walking on the grass. You didn't realize it, but that's what your brain did. Your brain went through every one of those scenarios that fast. But you chose the one that your brain said this is the best one. So you're walking down the sidewalk, through the hole in the sidewalk, you look down and you go like this. You never realized that your brain went through all those other options that fast. That's how we've become such a successful species. These other species would go, oh, I don't know, I'll just walk in the street. And they get smashed like those squirrels. That's bad. That's a bad decision. So the frontal lobe helps to identify the benefits and consequences of future actions. So it's not just long-term stuff, it's saying. The parietal lobe contains the gustatory cortex. Taste. So this is where you taste. You taste here. You don't taste with your tongue.
Taste what?
Those aren't taste buds, those are taste switches.
My taste switches don't like coffee.
No. They're taste switches. Call them what they are. It's a switch.
My taste switches told me I didn't like coffee.
No, your brain tells you you don't like coffee. Your taste switches just sent that flavor to your brain. Your brain identified it as coffee and said, ew, yuck. Which is fine. More coffee for me.
And it's the same thing about Twix.
You wouldn't like Twix. The parietal lobe also contains the areas where you're going to feel things like pain, temperatures on your skin, for instance, vibration, things like that. The temporal lobe, this is where hearing takes place. But understand this, when I say hearing, I don't mean you're understanding my sentences. When I say hearing, I mean sounds come in, you can interpret, oh, there's a horn from a train, or that's human speech. But you're not actually understanding what I'm saying here, you're understanding what I'm saying here. This is just interpretation of sound. Because you don't actually hear with your ears, you hear with your brain. Oh, the olfactory cortex is also found here, by the way.
The who?
Olfactory, where you smell. You smell with your brain, right here. You don't smell with your nose. Then finally, the occipital lobe. The occipital lobe is where we find the visual cortex. That's where we see. This is where we see. The occipital lobe. We don't see with our eyes, we see with our brain. People will never believe that when I say it. And then I ask them a question like, have you ever had a dream at night? And they say yes. You ever see a friend or a relative in your dream? They say yes. I ask them, were your eyes open? No, they were not. You don't see with your eyes. Your eyes just have some switches in them. Light comes into the eye. Those switches in the back of the retina. They either get switched on or they do not get switched on. Those are the two options. And if they get switched on and the ones that don't get switched on, all that information goes back under the optic nerve, which goes back here, crosses over, part of it crosses over, so that you get part information on this way, part information on this way, and it all creates a picture right back here in the occipital lobe. That's where vision takes place. You don't care. This is good stuff.
It's just really messing me up that you can't see, that you don't know like why it forms an image or how, and yeah.
Correct.
You really messed me up with that one.
Yes,
My
because
head
we
is.
don't. Yeah, you just have to accept that it does.
Yeah.
That somehow it takes a bunch of electrical currents and some chemical messages and then turns it into what you see in your head. How that happens, nobody knows. We may never know.
Life is weird, like,
Yeah.
life is weird.
Thinking about that is like thinking about, oh, we're the tiniest little things in this giant universe.
Well, there's things tinier than us that make us us, make us us.
Yeah, I didn't mean
Make
like
up
the
us.
tiniest. I mean like we're just so tiny and we're, I don't know. It's
Yes,
creepy.
flying through space,
That's
out of
what
control on
actually
this
have me
rock.
thinking of some other shit.
What's that?
Some other shenanigans.
I don't know what you're saying.
This discussion made me think of that.
Okay. Well, the thing about that is it comes to everyone.
Unfortunately,
The best we can do is try to avoid putting ourselves into an early death by avoiding situations that risk our health and risk our lives.
like smoking cigarettes.
Like something like that, yeah, okay, whatever. But there's riskier behaviors,
Like eating Twix bars
like
or drinking too much coffee.
driving recklessly, speeding.
Is there such thing as drinking too much coffee?
At one time, yes, absolutely.
Like, but throughout
I have
the
not
period of the
reached
day?
that yet. That is definitely not nowhere close.
Or drinking
But-
too much red wine.
But well, yeah, there's definitely problems with that. But we see that everything we put in our body has side effects. Hopefully you see that now.
Mm-hmm.
So there are things that come with coffee that are both a benefit and a risk. The most obvious being caffeine. And not only what it does to the heart rate, but it also blocks the anti-diuretic hormone, which increases urine output, which increases water loss, which
Didn't know
increases
that.
dehydration, which of course has a creates a big problem in the body because we need water in our body. We need it as one of those things that we need to make energy. Or is it like glucose, oxygen, and water? So if cells are losing water through the dehydration, then they're going to be not making energy. So there's lots of potential problems that can come from
So
drinking
coffee is
too
supposed
much.
to give you energy, but it can also make you lose energy.
Correct.
Interesting.
Yes. In excess. Yes. Where were we? Occipital lobe. So that's why I say the occipital lobe is like having eyes in the back of your head. Because everyone's familiar with this saying. I think most everyone is. Just a reminder that that's where vision takes place. The cerebellum. Oh wait, not the cerebellum yet. Let's go to the diencephalon. The diencephalon is located on the inside here. And there's a couple of important parts. One important part is the thalamus. The thalamus is a giant relay center that helps to direct all this information that's coming into our body, into our brain, excuse me. Make sure things are going to the place they're supposed to go, makes the right connections. Helps in making those other connections later on, like when you're someplace and you open up an old trunk at a flea market and it smells just like your grandmother's closet, and suddenly it puts you there and you can envision everything around it. All those memories, this is the result of all this information all coming connected together. One of the things that does, one of the jobs of the thalamus is that it's a big relay center. Thalamus. And below the thalamus is the hypothalamus, which is exceptionally important. The hypothalamus creates a lot of starting hormones, so it's a big part of the endocrine system. But the hypothalamus does something else. And this is important, with body metabolism. Now, I think everyone's familiar with the thermostat, right? The thermostat on the wall, you set it to be 72 degrees. If the room temperature falls below 72 degrees, it sends a signal to the furnace, kicks on the furnace, brings the temperature up. That's the job of the thermostat. That is not what the hypothalamus does. The hypothalamus is the guy who sets the temperature on the thermostat. The decision maker says this is what normal should be. So that's kind of a big deal. A different part of the brain acts as the thermostat. This is the guy who sets all the guidelines of what normal should be. Let's see, we talked about the ventricles. That's where we find the cerebrospinal fluid is made in those ventricles. We go to the brain stem. The brain stem is divided into 3 parts. The brain stem attaches the spinal cord to the brain. Let's see if I can do this. There we go. Let's go with that. Let's go with that. And let's go with that. Okay. So actually, hypothalamus is here, the thalamus is here. Here's the pituitary gland, by the way. We'll see that later on. This right here is the midbrain. That's the top part of the brainstem. This part here is called the pons, which is a Latin word for bridge. And this part here is called the medulla oblongata. Medulla oblongata. So the midbrain has an area in it called the substantia nigra where dopamine is made, a neurotransmitter, as a for instance. The pons, like I said, is Latin for bridge. It's in direct communication with the cerebellum, which is this part right here. And the medulla oblongata, that part acts like the thermostat. It's taking in real time what's happening in the body and making real time adjustments, sending messages out for real time adjustments. Which takes us to the cerebellum. The cerebellum, one of the main things the cerebellum does has to do with posturing, like telling your brain, your body, how you are in 3-dimensional space. Like if you're tilted to one side, if you're upside down. That makes sense. So this part right here helps with equilibrium. Now, a lot of people, you may have heard them say something like, if there's a problem in your inner ear, that's going to mess up your equilibrium. That's where equilibrium happens in your inner ear. Well, there is a part of the inner ear that are the switches that send the signal to the cerebellum. But that's actually not where the equilibrium takes place. It happens here. That's one of the main things. There's an interesting group in Turkey, a family, where they have a cerebellum that isn't functioning or partially not there. And they're interesting people because they can talk normally and act normally, but when they go to walk, they have to walk on their hands and feet. Not their hands and knees, their hands and feet. Because they don't have a balance. So they can stand up against the wall like this, and lean on something, but as soon as they start to walk, they have to go down on their hands and their feet. And that's the result of a non-functioning or partially non-existent cerebellum. It's just an unusual genetic trait, hereditary trait in this case, that that family has. Not a good one, by the way. And for a long time, this family has been studied for years. And for a long time, nobody really thought to do anything until one time they were being studied and the researchers said, what if they had a walker? Something to balance on. And they gave them a walker and it worked fine. So they didn't have to walk bent over anymore on their hands and feet. So it's interesting that so many people, so many doctors and researchers took years and studied this family and watched them move, and
Didn't do anything.
nobody at all considered the idea of something as simple as a walk for a while, so I thought that was interesting. You clearly don't care. All right, that's fine. Well, let's talk about another part then. The meninges. You may have never heard of the meninges, but you've certainly heard of meningitis.
Yes.
Meningitis is inflammation of the meninges. And the meninges are these layers, these protective layers around the brain. There's 3 different protective layers, going from the outside in. So if we drill through the skull, the first layer we come to is going to be the thickest layer, which makes sense. It's closest to the outside world. And that is called the dura mater. And in some areas, the dura mater splits, so it's actually 2 layers, but it's still the outer layer. Beneath the dura mater is the arachnoid mater. It got its name, arachnoid, spider-like, because just beneath it, there is this spider web-looking area called the subarachnoid space. Now, the significance of the subarachnoid space is that this is where cerebrospinal fluid flows. You see the blood supply here? Okay, I want you to understand this. Our neurons in our brain are very, very delicate. We don't want just anything coming in contact with them. So we don't want just the blood to go to the brain. We only want the best parts of the blood to go to the brain. So there's a barrier between our brain and our blood. And that barrier only allows certain substances to move through here and into the cerebrospinal fluid. And now that delivers the nutrients around the brain. So the subarachnoid space is important that way. This is where the cerebrospinal fluid circulates around the brain.
The layer inside of another layer.
Well, the dura mater is the top layer. The arachnoid mater is the second layer. The space here is called the subarachnoid space, which is where you see that spider webby thing. And then there's even another layer, the pia mater. This is the thinnest layer.
Oh,
And this one is shrink wrapped around the brain, so you can see it goes all the way down into all the gyri, the sulci, around the gyri, down the sulci. That helps to create that barrier, helps to have protection, all these layers. So why is meningitis bad?
Well, you don't want an inflammation on your protective layers.
Okay, you're right. Why?
Could cause swelling of the brain.
What follows inflammation?
Edema.
Edema, swelling. And if their area starts to swell, in other words, fluid collects and collects and collects and collects and collects and collects, something's going to have to give. Does the skull give?
No.
Nope. So if something is in here and it's growing and growing and growing, it's going to do this.
Crush the brain.
Yes. That means blood supply to the brain is going to get smashed, neurons are going to get smashed, brain is going to get smashed. We don't want that, because then we're talking about neurons dying, tissue dying, brain dying. This is why meningitis is so bad. This is why people are terrified when they hear about a meningitis outbreak at a school. This is why we give those vaccinations against meningitis when people go to college.
How is meningitis caused?
Now you're asking me the wrong question.
So what causes meningitis?
Still the wrong question. Because
I don't know what the right question is then.
that implies that you don't know what causes inflammation. And what causes inflammation? Two things.
Infection.
Say it again.
Infection.
Infection is one, what's the other?
Injury.
Injury. Those are the two things that cause inflammation. So if there's inflammation, it's caused by either injury or infection.
So when there's an outbreak, it's the infection?
So when people talk about meningitis, we have to assume they're talking about an infectious meningitis. Now, what are the two things that cause most infections in the body?
Bacteria.
Bacteria
Virus.
and viruses. Can fungus cause infection? Yes, it can. Can parasites cause an infection? Yes, it can. If there's a fungal infection of the meninges, can that cause a meningitis?
Yeah.
So is there such a thing as a fungal meningitis?
Yeah.
I would say there would have to be. What about a parasitic meningitis?
Yeah.
I would say there would have to be. But are parasitic infections contagious? Not really, for the most part, not really. Fungal infections, not really, for the most part, with the exception of a few. So when we talk about meningitis, and people talk about being fearful of meningitis, it's probably either bacterial or viral, because we know that those things can easily be spread person to person. So most of the time when people talk about meningitis, they're talking about infectious meningitis, and when they're talking about infectious meningitis, they're talking about either bacterial or viral infectious meningitis. Now, which one's worse?
Infectious?
Yes, of those two, which one would you want to get, which one would you not want to get? No, you have to choose one. That's not the kind of game we play here.
You wouldn't want to get viral, but you would better get bacterial.
I think I would want to get like a fungal, I guess.
Yeah, bacterial.
No, just a bacterial viral, those
Yeah,
are your
I've heard-
options, which
yeah,
one
I've
do you
heard
want?
that.
Bacterial
I've
or
heard
viral?
Because you can
Yes.
treat it with
That's
antibiotics.
You are exactly on the right path to a wrong answer.
Oh, okay.
Because, Brooke, I would say the same thing. To me, it would make sense. I would say, well, I would rather have a bacterial one because we have so many antibiotics to treat it,
Nothing.
rather than virals. We don't have a lot of antivirals to treat it. So a bacterial one, please. Actually, we're wrong. The viral one is the better one to get in this case. And that's simply because the viral one isn't as severe. The damage that it causes is much less severe. The inflammation and therefore the swelling that it causes is much less severe. The bacterial one is much more deadly. You wouldn't think so because of the ability of things like antibiotics.
Do we have an antibiotic for bacterial meningitis?
Depending upon what the bacteria is.
And it would just matter on when it was caught?
Speed, exactly.
Interesting. I didn't know that there were so many different kinds.
Yes, exactly. And that's something that they don't really clarify in books sometimes. But yeah, there can be other things that cause an inflammation of the meninges. But we just are automatically assuming when people talk about that it's either the bacterial or viral infectious.
because it's not so common.
Gotcha.
Now, there's an interesting parasite that you hear about, usually once a year in the summertime. It usually makes its round on Facebook. They call it the brain-eating amoeba or the brain-eating disease or something.
Did you catch on?
And this is the result of an amoeba, it's a parasite, microscopic, that makes its way to the brain by going up the nose. When people are swimming in a lake or a pond or a stream or something, a river. And it's incredibly deadly. Since its first discovery, there have been I think like 160 some cases in the United States. It affects all ages, although most of the time it affects children, but anybody can be affected by it. And it has an incredible mortality rate. Most of the people who get it die like that day. It's really bad. So if a person has these complaints after going to swimming, they suddenly have these severe headaches, you gotta get them right to an emergency room and make sure they understand that that's a possibility. Because if it's not treated correctly, they die. They die.
Wow.
And foul eye to this day. All right, has everyone signed in? And why not? Dan's not here. Brooke, you here. Olivia,
Yeah.
Molly,
You.
Janet,
Yeah.
Victoria,
Here.
Sierra,
Here.
Selena,
Is there?
absent.
Is there?
Charlie is here, right?
Yeah, she just.
Yeah, she just walked in, she says.
Yeah.
She said she gotta get her book there.
Irma's not here though, is she?
Nope. Why do I
Nah,
keep-
son.
Selena, who's the girl that sits next to you? Why do I keep drawing a blank on her name?
Lashonda.
Lashonda.
I like that. That's Lashonda. Lashonda.
Not
So we're gonna take a break.
What's the,
Here we go.
when is this class over?
Couple of days.
hang in there. Get comfortable.
Meningitis. Talk about that. Blood-brain barrier. We talked a little bit about that already. We'll talk more about it later. But the blood-brain barrier is what helps to keep those things out of our blood that can interfere with the brain. In fact, there's always a good clue when something does pass the blood-brain barrier, when it is able to cross, that you might not have expected to or wanted to. And the side effects are usually pretty similar. I'll give you a really good example of something everyone is familiar with. Diphenhydramine. Have you heard of this? Diphenhydramine? Okay. Have you heard of Benadryl?
Yes.
All right. The active ingredient in Benadryl is diphenhydramine. That's why if you buy the generic brand of Benadryl, it just reads diphenhydramine on the box. So diphenhydramine is one of the medications that crosses the blood-brain barrier. So what is the side effect? What's the side effect of Benadryl?
Sleepiness.
Sleepiness, drowsiness, yeah. So you can always tell one of the side effects of a medication that crosses the blood-brain barrier very commonly causes drowsiness.
I'd be knocked out with her girl. Yeah,
Yes.
that hurt. I was. Oh, that. I remember someone like how.
Yeah, well, it can work as a sleep aid. It really can. And it's sometimes even prescribed as a sleep aid.
Yeah, they told me that my
Off-label.
daughter wasn't sleep. I think it was 6 months. You know, then to give her Benadryl, I'm not driving my daughter so she goes to sleep.
Well, it's a comfort thing at that point. It's not just about, I want to put my child to sleep because I want to do something else. It's the child needs rest and comfort. And so sometimes children's Benadryl is very helpful in doing that. But it's not, but you're right, it's not to be used just because I want to put my child,
But my
knock my
daughter,
child out.
like, my daughter slept all night since, like, and when we were still in the hospital, she would wake up in the middle of the night. But once we were at home, she would sleep all night long.
That's good.
So when it was telling me, I was like,
Then if you feel it like that, then that's fine. Yeah, I'm just saying that it could be, but I agree with what you're saying. Your mind, you don't want to use it as something just to knock your kid out. Okay, that's fine.
but ain't it like an allergy medication?
Yes, but we can write it off-label as a sleep aid. But when we say write something off-label, what that means is that the FDA approves a drug for one thing, but we know that it also does something else. So even though it's not FDA approved for that, we can still write it as a prescribed medication for that reason. It's even helpful for motion sickness. If you're like on a long car trip, you're not a driver, but like a passenger on a long, because you don't want to drive and take it.
we're gonna die.
If you're on a passenger on a long car trip and you're starting to feel a little bit queasy, you stop at a rest stop, you can take Dramamine, that's a motion sickness over-the-counter medication, or you can just take some Benadryl, and that will help. It doesn't work as well, but it does work.
I like her hair.
Okay, yes, she has wonderful hair. Your hair is wonderful. It is like heaven. It's like Christmas morning. It's the stuff that dreams are made of. But it is not your toy.
Continue.
Stop playing with it. All right, the spinal cord. Let's look at the spinal cord for just a moment.
Do I have to?
Yes.
Like, no.
The spinal cord is awesome.
Well, I can't look at my story first.
No. Because we're gonna talk about something that goes along with the spinal cord called the reflex arc. So, typical diagram of a spinal cord is made up of a bunch of neurons, just like the brain. And it has white matter and gray matter, just like the brain. The difference is, with the brain, the white matter is on the inside, the gray matter is on the outside. Here it's switched. The gray matter is on the inside, the white matter is on the outside. And then it has these 31 branches of spinal nerves that branch off all the way down the spinal cord. And they're gonna send messages into the spinal cord or messages out and away from the spinal cord. So let me show you an image this way. Okay, does everybody recognize what this is?
The tongue, the throat.
No.
Wait, what is that? Oh, I see. Okay. Yeah, I see.
Does everyone recognize what this is?
I know it too.
It's a vertebra, right? Just like this. So the spinous process of the vertebra is actually sticking out the back, right? Of your back, it's what you can feel right down the middle. So the spinous process here is the back, so that skin right there is the person's back. You'll notice, here's the spinal cord.
And that's
Now-
the body of the vertebra right there?
This is the body of the vertebra, yes, right here. So if this is to scale, the spinal cord is right in the middle, right here. Which means if this is about the average size lumbar vertebra for an adult, this would be about the size of the spinal cord in that area.
Wow.
Spinal cord's about,
Yeah, you
I don't know why I just pictured it so much bigger.
It's like
I know, you would think it is because it's so important. You'll notice there's nerves here and nerves here. These nerves coming in are bringing messages to the spinal cord. Like something's on your arm, or something is sharp, or something's cold, or even internal messages, your bladder's full. These nerves are bringing messages out, like contract that muscle, move that arm, move that leg.
So one side brings them in and one side sends them out?
No, back.
Oh,
The
back.
posterior ones are incoming.
Gotcha.
Oh,
The-
okay.
The
Oh, I
ventral
see.
ones, yeah,
'Cause it's
are,
so linked.
yeah, these are outgoing messages to the body.
Okay.
Gotcha.
Now, the reason this is important is because the spinal cord still has those layers of meninges around it, the dura mater, the arachnoid mater, and the pia mater, but it also has another thing right here called the epidural space.
Mhm.
The epidural space is unique to the spinal cord. So if we take a needle and we inject an anesthetic agent right into that epidural space, it's going to affect these nerves,
In
which
one.
means it'll cause these nerves to be blocked.
The signals.
So the
Okay.
signals coming in like pain won't be felt. But these nerves sending outgoing messages will still be active, so you can still
Still
move
move.
your toes, exactly.
Okay,
Interesting.
okay.
Look how that works.
Oh,
So
okay.
that's where we get, our
Epidural.
Stops
epidural
the
shot?
It's an anesthetic, yes.
Oh,
Stops the thought of pain, but doesn't stop your reaction of feeling,
The ability to move.
or the ability.
Yeah. And for those who wonder or have heard that epidurals, anesthetics don't work, that's sort of true sometimes.
Mhm.
It's sort of true sometimes because it's a medication. And when I have a headache, I take 2 Advil. That works for me. But when she has a headache, she's got to take 4 Advil.
Mm-hmm.
That works for
It ain't
her.
for everybody.
When she has a headache, she's got to take 6 Advil. When she has a headache, Advil doesn't work at all. She's got to jump to Percocet.
Wow.
Basically.
Sorry, yeah,
800
just put it
milligrams
right there.
With
So it's not that it does work, it doesn't work. We already know that it's not going to work the same for everybody because no drug works the same for everybody. There's a window. We call this the therapeutic window of how medications work. So some people are going to require a bigger dose, some people are going to require less, some people might not work at all. We know that. But we also know that Advil works really well for headaches. So we start with that and that's what we have and it works well and hopefully that'll do the trick. Now, interesting fun fact, I don't know if I told you this, redheads require more anesthesia. I tell you that?
No.
No.
Yeah. I don't know.
Seriously? So they go by averages, I assume,
Averages,
a woman?
yeah. But again, you gotta remember, with other medications, They do it by
Wait.
weight. Children go by age oftentimes, but there's still always a weight discrepancy because it's about how the drugs are metabolized. But yeah, we don't know why that's like that with the anesthesia. Nobody really knows.
How do you
What's that?
work that?
Fluorescence space.
And
It
then what
depends on the
causes
type.
I guess.
Most
like
headaches
stress.
are a result of stress, and that causes a change in blood pressure, compression of blood pressure. You can take that out by relaxing muscles, or just stopping the inflammatory process.
What is
which
that,
is why
the
we give it
signal,
insulin.
how it's going to the skin?
Those are nerves.
Okay, I see.
So those could be incoming messages of touch, sensation, pain, things like that.
Alright, yes.
Now, what a lot of people don't understand, first of all, everybody knows the brain is what you think with, right? The brain is
Correct.
your thinking device. A lot of people don't realize, bless you, is that your spinal cord also thinks. Your spinal cord also makes decisions. Because when that person touches that hot stove, as soon as their fingertips touch it, what happens?
Hand moves away.
Their hand moves away, then their body moves away. Then they look at their hand and they look there, right? Because the signal travels up the nerve from their fingertip to their spinal cord. The spinal cord says, okay, we got something hot right here. We better do something and act on this quickly. So let's move the hand away, in fact, move the whole body away. But then the signal continues up the spinal cord to the brain that interprets it. So that's why there's that little bit of a delay in between actually pulling your hand away and feeling something and understanding what just happened. That's called the reflex arc. Information coming in, makes a quick decision, sends information
Can I see
out.
the vertebra you had just now?
Vertebra, singular,
Vertebra.
vertebrae, plural. Are you gonna let go of her hair?
No. Okay. Why does that one look separated and this one look like? Okay, but you see where,
Where the nerves are coming in and out.
yeah.
How it's a solid
Yeah,
hole
this
versus
is
there's
solid,
cuts
that
on
other end.
Because that's a model.
Okay.
oh, so the model's gonna stay together, but really a real vertebra is two pieces.
No, there's gonna be an entrance area. So if you took a vertebra, remember, you're only seeing a slice of this.
Oh, okay.
So if you took that and sliced, yeah, there's an opening there. But if you slice that away, well then, no, you're not gonna see that. It's less of an opening, more of just a little arch. But yeah, it's still connected. I understand what you mean though. Yeah. Don't get me confused. Right. You can see it's gonna arch right here. So if you sliced right here, you would see where that nerves would come in this way, but it would look like there were two different parts. I'm trying to make it so you can see how you would slice it, like right here. So you'd still see this part here, you'd still see,
So
part
that's
of
what's
this
showing
here.
on the image on the screen is like.
yeah, it's a
like-
slice, like you see in a CT scan. It's
So
just
like
a,
if you cut that arch.
like a loaf of bread,
Yeah.
and you took one slice out of the middle of it. That make a little bit of sense? Oh. These are the afferent nerves coming in. These are the efferent nerves going out. And those are in the anatomy notes, the terms afferent and efferent. And they're important because you're going to hear them in other places, not just when we talk about nerves. Afferent always is bringing something in. Efferent is always bringing something out or away. E is for exit, right. I actually have that in my notes.
Oh,
E is
okay.
for exit. Okay. We have these cranial nerves. We call them cranial nerves because they, stem from the brain, and they affect basically the head and neck region. And you'll notice there's 12 of them here. And we call them cranial nerves 1 through 12, or sometimes we'll just abbreviate capital C, capital N, CN nerve, CN12 or CN5 or CN2. And not only do they have Roman numerals, but they also have names: olfactory, optic, oculomotor, trochlear, trigeminal, inducens, facial, vestibular, cochlear, glossopharyngeal, vagus, accessory, and hypoglossal. Then it also tells you what they do. Under the nerve type, you'll see that it's a sensory nerve, or it's a motor nerve, or some do both. Sensory means incoming messages, like smell or vibration. Motor means outgoing messages, like move your tongue, move your eyeball, move a muscle. And then both of those nerves have incoming and outgoing messages. Now, for this test, really the only ones that you're going to be talking about is cranial nerve 5, the trigeminal nerve, cranial nerve 7, the facial nerve, and then the unique one, cranial nerve 10, the vagus nerve, because vagus means wandering. It's Latin for wandering or wanderer. The vagus nerves, of all these cranial nerves, it's the only one that actually goes all the way down into the abdominal pelvic cavity. So that's sort of unique. And the nice thing about those three that I've chosen is all of them are both motor and sensory, both motor and sensory, both motor and sensory. So that's a neat little chart. And of course, there's one in your notes. Okay. Let's talk about neuroglial cells. The neuroglial cells. Glia means glue. So these are the cells that hold everything together. They help out with the neurons. In fact, if you added up all the nerves in the brain and spinal cord, nervous system, there's actually more neuroglial cells than there are neurons. We don't care about that. So, the first neuroglial cell that we'll talk about are called astrocytes. Now, astrocytes are cells that are described as having radiating branches. Radiating branches. So when I think of something that has radiating branches, I think of this. A star has radiating branches that goes out. So when I think of an astrocyte, I think of it as sort of being star-shaped. And the neat thing about the star shape is that it even kind of has the letter A kind of built in there, A for astrocytes. And the astrocytes, yeah, exactly. That I do as well. I think of astro like stars, astrology, astro stars. So I think of radiating cells, also branch-like. So again, it makes me think of stars. And these cells make up the blood-brain barrier. So I think of that as being like a fence made up of stars. Thank you. And that is going to help separate the blood from the brain. So when I think of astrocytes making up the blood-brain barrier, this is how I've always sort of seen them in my head. A fence made up of stars that separates the blood from the brain.
Wait, so the blood is not the brain?
Well, like I said, we don't want contents that are dangerous in the blood to interact with the brain if we can help it. So that's why it goes with that cerebrospinal fluid, and the cerebrospinal fluid is what circulates around. So that fence helps to keep things in the blood that we don't necessarily want to interact with the brain. And then all the good stuff goes in the cerebrospinal fluid, that circulates around the brain and spinal cord. Astrocytes, or the brain barrier. see. The next neuroglial cell are ependymal cells. Those are the cells that make up cerebrospinal fluid. Another neuroglial cell are the microglia cells. They go around and gobble up garbage. They're phagocytes. And then there's two neuroglia cells that you want to know about for your anatomy exam. And they're called the oligodendroglial cells and the Schwann cells. Wrong way. You're on the wrong page. Go back to that page, the bottom of the page. Last two things on the bottom of that page. Oligodendroglial cells and Schwann cells. Now, here's the thing about these cells. They do basically the same thing. Remember that insulation that goes around the neurons I was talking about? That insulation is made up of these cells. The oligodendroglial cells will wrap part of themselves around a neuron, and then part of themselves around another neuron, and part of themselves around another neuron. And they do it, the oligodendroglial cells do that in the central nervous system. The Schwann cells wrap their entire cells around the axon, and they do that in the peripheral nervous system. So both oligodendroglial cells and Schwann cells do basically the same thing. What page is that on?
45.
Yes, page 45.
Is this in the
Notes.
notes from anatomy?
Yeah.
Okay.
Page 45, bottom of the page. So if you understand they basically do the same thing, they just do it in a slightly different way. Here's what I would do if I were you. If I were you, here's what I would do. I would get a note card, and on one side of the note card I'd write CNS, and on the other side of the note card I would write oligodendroglial cells. Then I'd get another note card and I'd write PNS, and on the other side of that I would write Schwann cells.
I've seen a video.
Yes. Because even if you don't understand exactly what they're doing, at least this way you'll remember where they are. Does that make sense? So that's my advice to you. Take it or leave it. It's free. Your advice.
Well, thank you for the thing for it.
Pathology, good brains go bad. Brain pathology. For some reason, I'm sorry?
Yeah.
Okay. For some reason, I can't remember the first thing I wanted to talk about. The brain pathology. Oh, that's right, yes, amnesia.
Get funny.
First of all, there's different types of amnesia. Some amnesias, a person could remember what they had for breakfast, they can remember their name, but they intermittently forget things throughout the day. Some types of amnesia, the person don't know who they are, where they're from, but they remember what they had for breakfast. Other types of amnesia, they know who they are, where they're from, but they don't remember what they had for breakfast. There's different types of amnesia. Here's what you probably didn't know about amnesia. Amnesia is actually a defense mechanism. It's supposed to happen. Because the brain says, I don't want to remember that. That sucked. When that person was driving his motorcycle and a car pulled out in front of him, he goes flying off the motorcycle and hits his head first into a tree. His brain says, I don't want to remember that.
But all I do remember that.
I know. And the thing is, when the paramedics first get there to that accident scene, they're asking this guy what happened, he'll describe the accident to them in detail. But by the time he's getting to the hospital, getting wheeled in the hospital, he'll go, what am I doing here? What happened? Where am I? Because the brain says, yeah, you know what, let's just forget all that. Now, of course, sometimes it just does happen as a result of brain injury or brain damage. But, just like in the movies, where that patient has amnesia and is in the hospital bed and the family's with the doctor and they ask the doctor, "Doctor, when is my gonna get their memory back?" The doctor always says the same thing. Well, we'll just have to wait and see. Because we have no idea. We don't know if it's going to come back at once. We don't know if it's going to come back at all. Maybe take a little bit of time. No idea. Because remember, we don't really know how the brain works. So we don't know how it's going to be fixed, if it was fixed.
You know when we get out before? Oh my god.
Yes. Disappointing.
Right?
It got a lot of hype. I was really expecting good things from it. And I'm like, it wasn't bad, but I was expecting like something.
You're
I
77 years old?
Shut up. Yes, approximately. I will be this year, April 7th.
He means April 1st.
That was a good one,
You know
bro.
what?
He's like, I'll just show you guys.
Which one? Oh, that's a good one. Let's do that one next. Anencephaly.
But you gotta think about it, like, the
Here's
dude's
anencephaly.
been in school all his life, basically, so it's like, oh.
I'm still in school. Anencephaly.
Oh, baby.
Baby's born without a
Right.
cerebrum. Yeah. Or cranium, there's just skin on top. Now there's degrees of anencephaly. This is total anencephaly.
Is it long?
Well, no.
Technically brain
This-
dead, right?
Yeah, this is total anencephaly. So if there's anything there, maybe brainstem, maybe. Which means if there's a little bit of brainstem there, they can live for like 5 minutes outside of the uterus, if they're born alive at all, which is rare.
Wait, but
Because the signal gets sent to the brainstem, and the brainstem says, okay, here's what we need to do, and then the brainstem asks the brain, what do we do next? And there's no brain, so it just doesn't do it.
like no breathing or anything. Gotcha.
So I mean, you put it on a ventilator, but then there's a.
I was
we
gonna
kinda
say,
put
so
somebody
like
dead on
brain dead
it. It's
people,
not
it's
doing
just,
anything.
gotcha,
It's just keeping
keeping the body
the
down
body-
for no reason.
right. This is bad.
Yeah,
Yeah.
that's,
Yeah,
That's heartbreaking. I couldn't imagine giving birth to a child that wasn't gonna live.
They give you the.
You just gave birth to baby one second. And he died,
What was your question?
and they didn't tell him.
So,
Alright,
So-
can we not, keep looking at the baby apple like that?
what do I want to talk about next? Brain tumors. We're not going to finish. What about brain tumors? All brain tumors are bad.
Why do you want to talk about
Period.
Brain tumors are bad because even if they're not malignant, even if they're not spreading, if they're benign but still growing, they're going to put pressure on the brain, right? We call that a space occupying lesion. It's going to take up space where there should be brain.
What's this word for headache?
Cephalgia. Is that what I give you?
Cephalgia.
Yes.
That's what I give you every single day.
Mm.
Cerebral palsy. This is a result of oxygen deficiency of the baby's brain during the birth process. You've seen the commercials with the lawyers, which is why I include the fact in here that 80% of all babies with cerebral palsy or have cerebral palsy caused by something that was that could not be stopped. It just happens. Sometimes bad things happen. 80% of the time, kids with cerebral palsy are born that way because of things that were unpreventable. It just happens.
Can you explain, can you explain exactly what it is and the signs?
Exactly what it is there's an oxygen deficiency.
Okay.
At some point in time during labor and delivery, the delivery process.
Oh, so not ongoing, but it was just a
It
previous.
could have started, but we wouldn't have known about it or even considered it until she's in the hospital giving birth. But even then, you wouldn't really know that it was that there was a lacking, because you wouldn't see it change. If somebody's always getting deficient oxygen, then their bodies, if you go into a monitor,
It's
it's
just,
just gonna look like it always looks. It looks like everything's normal. What we're looking for in those baby monitors are changes, like those decelerations in the heart rate. We go, okay, now we have a problem.
there's no
But-
baseline for the amount of oxygen that a baby should be getting in utero.
Well, it's kind of hard to tell because the baby's in the uterus. So we can't put a little clip on the baby's finger. We put a little screw in their scalp, which we'll sometimes do.
Ooh.
Yeah, a little wire, just you sort of screw it in. And that gives us, it's sort of a reading. But how does the baby get oxygen in the uterus?
Through the placenta.
From mom breathing. Mom breathes oxygen in, it goes through her blood, that blood goes to the uterus. That oxygen, not the blood, the oxygen goes from the uterus into the baby's blood via the placenta. So the placenta brings the blood back to the baby through the umbilical cord. So if there's some kind of a problem with the placenta, that there's not a transfer of oxygen, or if there's some blockage in the umbilical cords, there's not that blood being transported to or from the baby, that's gonna mean the baby's gonna be deficient in oxygen. So that can happen as a result of the cord being compressed. Now you gotta remember, that baby's coming through a very small space,
When,
which means everything's getting compressed. So if that cord's getting compressed in the slightest way, it's gonna decrease the amount. But we usually see that in the form of decelerations.
when a baby is in the womb, so you're saying the oxygen travels through the, the placenta and everything, so I understand how the baby
Cell by
gets
cell by
oxygen.
cell diffusion.
Yes, but, so is the baby doesn't actively breathe until it exits the womb, correct? Because of the amniotic fluid?
Correct. The lungs are full of amniotic fluid. The lungs are even working
Oh, the
until
lungs
about.
are full of amniotic fluid?
Yeah,
Oh, I wasn't aware of that.
and the lungs aren't even fully functioning until the baby's about 22 to 24 weeks anyway. They won't function, even if you took the baby out, they won't function.
Yeah.
The baby get one breath in, one breath out, and everything will just stick together. They're not creating any surfactant
Yeah.
yet. This protein that we have to create to make sure that doesn't happen. So they're not even functioning. So the baby doesn't start breathing using the lung until it comes out of the uterus.
Yeah.
So of those cerebral palsy cases, 80% of them are caused by things that we just couldn't prevent. It was just going to happen. 20% of the time, we don't know what caused it. So the lawyers say, well, if you don't know what caused it, you're responsible. Of those 20%, 80% of those cases are found in favor of the doctor or hospital. So only 20% of the 20% of the cases are actually found in favor of the clinic.
Gotcha. I was gonna say, you can't really blame a doctor for not knowing
Oh,
everything.
But they do.
Yeah.
Because remember, that jury, that's not a jury of my peers. Those aren't doctors sitting up there. Those aren't scientists sitting up there.
Parents, children.
Those are people up there who don't understand science, who don't understand medicine, who don't understand how the body works, still call this whole thing their stomach. And they have this idea that if this happened to their kid or their grandkid, they would want a big check too. That's why juries are very sympathetic to pregnant women and babies, and they pay out huge sums of money to them. Which is why the malpractice for delivering babies is huge, costs so much.
Wow.
Because it's only a matter of time before you get sued.
Mhm.
Everybody gets sued.
I hear about it much.
I know. Wait,
Wait until we're actually in there.
yes, you will,
Is there like
but
giant meetings like, hey
Wait,
guys,
for
we're
what?
getting
Me?
sued today?
sometimes
Wow.
it directly involves a bunch of people, yeah.
Wow.
And it often does. I mean, the last time I got called for jury duty in Delaware, Delaware County, not Delaware, Delaware County. And I actually had to even show up for jury duty. And, the first thing they do is they sort of rule out who do they want on their jury and who do they don't want on their jury. And it was a medical malpractice case. So there was no way I was gonna sit on that jury.
Yeah.
And it was a medical malpractice case involving an emergency room doctor. And it also involved all the paramedics. And meanwhile, the day before I was sitting in there listening to this, I just got done teaching the paramedic students the exact same emergency medicine protocols that they were discussing in this case.
Wow.
So there was no way they would have wanted me there, because in my head, I'm thinking, yeah, sure, you did everything she was supposed to do. Everything was exactly how it was supposed to be done. There was not gonna be a different outcome. So they dismissed me pretty quickly as,
You would hit me, right? You like orange jerry?
well, I like the idea of it. I like the idea that we have a society that has jury trials and they just pick people
Yeah.
randomly. But the problem is, unfortunately, they pick people too randomly. And they go with people who just don't have any idea. And there has been talk for a while about creating a malpractice court made up of people with medical backgrounds.
I
That would
think,
be
I was
hard
gonna say
too,
that
though.
would make more sense, so.
But that would still be unfair, cause I think a lot of the same way cops are supposed to vet cops,
But
doctors would vet doctors.
But here's,
most
but you're thinking of doctors as people. Doctors are different from other people. We are not the same. We're not the same as a car salesman who will tell you, yes, this is the car for you, it's the best car for you, this is the car you need to drive, you gotta get it today. And by the way, I got 6 other people who are looking at it, they're coming back this afternoon. That's what most people are like. Most people are like, oh my God, yeah, that dress looks perfect on you, it looks wonderful, shall I ring it up? Hey, how about I get these earrings, that'll match perfectly. That's what most people are like. Doctors aren't like that. Doctors have a scientific mind where things are right and they're right, or if things are wrong and they're wrong. And if there's something in the middle, we have to have some sort of mathematical explanation to get there. So we don't do that. Doctors don't back other doctors who are wrong. Doctors say if that person was wrong, they are wrong, because that's not how we do it. We have differences in opinions. There'll be lots of doctors who say, Dr. Sturgeon's wrong, pregnancy is not a disease, or Dr. Sturgeon's wrong, that's not the best treatment for this. But it's not like it's not like we're wrong, it's not like I'm wrong or we have a disagreement where I say, that drug will kill you, and they're saying, no, that drug will save your life. It's not like that, it's more of like preferences or some bias. Like I grew up using this medication, I saw it worked really well. They've only known this medication, they saw that worked really well. So we have differences there.
So maybe it should be
But
head
we
to head.
never, and that's a good solution as
Head
well.
doctors, head regular people.
Yeah, and that's a good solution as well. Or maybe even not doctors and regular people, how about doctors and engineers?
Yeah.
Engineers are still scientists, they just don't have an understanding of medicine, but they have an understanding of math. And how, in order to come to a conclusion, you have to make sure every part in that equation fits correctly. Otherwise, the ending isn't correct.
I feel like having a doctor in that kind of setting would help because, especially in medical malpractice, the doctors themselves have learned like OSHA standards and stuff like that, so
Yes.
they can be more informative of that.
Yeah, that's what I said.
They
Versus
can,
having
but-
that knowledge
But also
whatsoever.
understand this, I could be on a jury with a whole bunch of people, and all those people absolutely believe without a doubt that we're putting microchips in the feet of babies when they're born.
That's a very good.
You can feel microchips under skin.
Because they all belong to Facebook and have gotten the same information. Whereas the doctor's sitting there going,
Oh my goodness.
I know, right? Where the doctor's sitting there going, no, that never happens. But 11 other people are saying, yeah, it does, because it was on Facebook. So,
I was asking, I
I-
told you I didn't believe
I
it.
know, stop yelling at me. So that's why having one doctor on there, you think, okay, well, they can help make sense of it. Well, sometimes people still don't listen. Because in those jury trials, they do have expert witnesses come in. Other
Yeah.
doctors come in and say, yeah, they did follow this protocol. Did you see on the news recently, there was a woman who's been in a vegetative state? And her
Yes,
husband
yes, I
slowly-
just heard about that yesterday.
She got pregnant.
Horrible.
And she got pregnant.
How did they let her go through with that birth? Like, why would they do that?
I was thinking it.
Wait,
too.
I
I guess just, I get what you're going with.
Say it again.
Continue.
It's still life.
What was
and-
going on?
The lady was
And it's still
pregnant,
technically her
she was
decision.
Correct. And since she
Oh,
can't
I
make the
see.
decision, it's her family's decision.
Yeah, they had enough.
Oh, I
to
do
make
not
that
like
decision.
that.
So, but what a horrible decision to have to make.
Exactly.
So the guy who they caught because they tested DNA from everybody who worked there, had contact with this woman, and everybody's DNA came up not a match, except his that came up a match. They said, this is a match. Did you hear what his lawyer has said?
It could be a familiar match.
What do you say?
His lawyer has said, well, there's no evidence connecting my client to this patient in this crime. He said, I understand there's DNA, but there's no evidence.
What?
Now, if
That's
DNA
evidence.
is not evidence, I'm not sure what is.
Yeah, that's the most crucial evidence.
He
Right.
got a good lawyer.
That is
No, you
not
got
a
a
good
dumb
lawyer.
lawyer.
That is,
Basically, you're saying y'all didn't see him do it, so he
Basically.
didn't do it.
but here's the problem with that, because nowadays we have things on video camera.
Yeah,
Yeah.
And people have it on video camera, and there's still an attorney who will say, well, no, that's not my client. It's like, we can see it's him. Well, no, it's somebody who looks like him.
That's why I don't like law.
He's holding a sign saying, this is me. Yeah, it looks like him holding a sign saying this is me, but we don't know for sure that that's him. He's yelling out his first and last name and social security number. Yeah, but a lot of people have names that are similar and numbers are just numbers.
Yeah.
So there's always going to be an attorney who's going to try to create doubt,
Yeah.
unfortunately. So that's an absolute
Ooh,
mess.
that's horrible. I'm gonna be really upset if you get
Right,
rid
they
of that.
But that's the
Really
point
best
of your
for
job,
money.
is to create,
It-
like to give you the
create doubt.
benefit
It
of the
is.
doubt.
It is, and that's not a bad thing when it comes to trials and when it comes to medical malpractice. It's good to have doctors who are lawyers who are making sure that patients get treated fairly.
Yeah.
However, there's a line. There's a line where it goes from you're doing something that's helpful and moving things forward, keeping everything safe, and then there comes a point where it's like, okay, now that's just ridiculous.
It
And
is.
even you have to say, this isn't about the law anymore. This is just me trying to confuse people, me trying to win at all costs. And that's disregarding that mother and that child and that family that's involved.
Yeah, it is.
I'm sorry, I'm off on a rant. What time is it? Is it time for a break yet?
Yes.
Look at that. Next, right? CVA, that's a stroke. Disruption of blood flow to the brain. Usually people talk about strokes caused by clots, but realize that anything that disrupts blood flow to the brain can cause a stroke.
12:30.
So even a person with a severe heart attack, that means their heart's not pumping blood to places like the brain. So people are sometimes surprised to find out that their relative had a heart attack, and when they're at the hospital, they also have a stroke. And they think, oh my God, how terrible, they had a heart attack and a stroke. Well, yeah, because they could certainly go hand in hand. If you stop pumping blood to your brain, that's a disruption of blood flow.
How about seizures?
We're not there yet, it's on the next page.
Oh.
Yeah.
I don't want to talk about dementia's next.
Yeah.
Yes.
Yeah, we'll skip dementia. We know about that.
Concussion.
Dementia is cognitive dysfunction, cognitive decline. Most commonly caused by Alzheimer's disease, but senile dementia can also cause it just as we get older. Let's see, let me think. We talked about Down syndrome already, trisomy 21. What is after that? Don't tell me. I think it's encephalitis. Okay, then tell me.
Starts with a D.
Death?
Dyslexia.
Death. We do have to discuss death.
Okay, no, we're not talking about dyslexia. We know what that is. People seeing numbers, letters backwards, mixed up. Then encephalitis.
I used to think people
Inflammation
just
of the
lying in
Inflammation of the brain.
No, I
And-
mean.
Again, inflammation of the brain is bad. Why?
Cause it could swell.
There you go, swelling.
Pressure and crush
Now, the thing I want you to notice with encephalitis is the most common cause of encephalitis I listed first, herpes simplex virus. Most people think of herpes as that thing that causes cold sores or those things on the genitals. Most people don't think of herpes as causing encephalitis, which could be deadly. But it can. It's the most common cause of encephalitis.
So does meningitis cause encephalitis?
No, those are separate.
Gotcha, okay. Just causes swelling.
Correct. And then I think the other ones I listed there, cytomegalovirus, West Nile virus, no particular order.
Epilepsy.
Epilepsy is next, yes.
Yes.
Okay, the brain spontaneously sends out irregular, erratic signals. And in order for us to call it epilepsy, it has to have two components. It has to be recurrent. In other words, if a person has one seizure, that's not epilepsy. It has to be recurrent, there has to be a history, or at least more than one. And it also has to be idiopathic. If a person has a seizure because they hit their head really hard, then that's not epilepsy. If a person has a seizure because of a very high fever, that's not epilepsy. It has to be idiopathic.
Interesting.
And I've listed the two main types of seizures there. The first one's called a grand mal seizure, or a tonic-clonic seizure. It's not a grand mal seizure, that's when grandma has a seizure. This is what you think of when somebody has a seizure. You think they lose consciousness, their arms are falling out, etc. Usually over. They usually last anywhere from about 10, 15 seconds up to about a minute on average. Now, a person could have a condition where a seizure continues, or they have one right after the other, and that's dangerous.
I was gonna
We
say,
call that status epilepticus, and that can be deadly. But most of the time, it's not that.
Okay, so I will argue to this day, like, I don't understand how my mom had a seizure in the middle of her asthma attack. Like,
I don't know.
can someone get a seizure by suffocation or something?
Well, they could,
Lack of oxygen.
exactly.
Okay, so this is
But
how.
there's oftentimes something else that would, a seizure disorder is already present, and that just sort of triggered it.
So my mom was giving herself an asthma treatment. My brother and my sister literally went down the street to 7-Eleven, like 5 minutes to get soda. They came back and my stepbrother was outside on the phone with the ambulance because my mom was purple. So like literally 5 minutes that they went out, and it was only my mom and her husband in the house. And he went inside because he heard my mom like trying to call him, and he knew she was giving herself an asthma treatment. So when he went upstairs, she was purple. When he came downstairs, her husband was walking around smoking a cigarette, and my mom was upstairs like suffocating. So when my mom's husband saw my brother and sister ran upstairs, that's when he wanted to run upstairs and act like he wanted to give her CPR.
So where did the seizure come in?
That's what the paramedic said.
Could it
But
have
she
been
had
a
a
seizure
seizure in the
instead
middle.
of the?
I don't know. And again, unfortunately, I'm getting information from you who got it from somebody else,
Yeah, because I wasn't there.
who got it from somebody else. So I don't know, I can't explain that.
Can the babies have seizures?
They could have a seizure, yeah, it would be unusual, but absolutely.
How would that feel to the mom?
It depends on the age of the baby, it depends on how far along they are. It depends on what type of seizure it is. Because not all seizures are the same, not all seizures are like flailing around, they could be much more limited.
Yeah.
So it might just feel like abnormal movement. In some seizures, a petite mal seizure, in those types of seizures, the patient is sort of,
Oh, looking like that?
yes,
Oh, y'all looking around like.
it's always fun to make people turn that. But yeah,
Wait, what you said was a thing that was like motion still,
the trapezius muscle.
the trapezius.
So seizures are just a cutoff of oxygen to the brain?
No, seizures, the brain sending out erratic, just strange signals, just randomly shooting them out.
Oh. And then,
Don't put anything in the person's mouth.
I was gonna say, so what makes them.
They're not going to choke on their tongue.
That's not true?
No, it's not going. First of all, people say they're going to swallow their tongue.
Yeah.
Well, in order to swallow something, you have to chew it up and it goes down the food tube into the stomach. So when they say swallow their tongue, what they actually mean to say is the tongue's gonna block their airway. But that's actually not gonna happen, the tongue's not gonna block their airway. Can you come in? No? Yes? No? I don't know.
You gonna pick that, Peter?
Maybe it's a tour, I don't know.
It's not, the guys checking on the fire alarm stuff. They were scheduled to be here yesterday and today working on it, so. Anyway,
Swelling of the tongue.
Yeah, swelling of the tongue, this is not gonna block the airway. Unless, let me rephrase that, I didn't speak that clearly. The tongue itself is not gonna block the airway. If the tongue gets swollen, like really swollen, that can cause an airway obstruction.
And that happens
But
in
that,
bladders,
that's,
right?
no, that's usually the result of a mixed bacterial infection. It's called Ludwig's angina, and that can cause it, but that's not associated with seizures. People biting down on their tongue is not going to swell it enough to cause it to block an airway. And people say, what if they bite off their tongue? Well, they're not going to bite off. They only bite through it. I've seen kids bite through their tongue before, not from seizures, but from other accidents. But still, that's better than you putting something in their mouth. Because if you put something in their mouth like this and they bite down on it, they could break that and it could go down to their airway, and now you've created an airway obstruction. If you put a metal spoon in their mouth, they could bite down on the metal spoon, break their teeth. The teeth could go down into their airway, that could create an obstruction. If you put your finger in their mouth, they could bite down on that and actually bite off part of your finger. That could go down into their airway, that could cause an obstruction. Plus, now you can't point at things. I want that. Favorite epilepsy joke.
When you're having,
So, don't put anything in their mouth.
but when you're having an allergic reaction, don't some people have experience a swollen tongue?
Yeah.
Gotcha.
Yeah, but in that case, again, putting something in their mouth is dangerous.
Yeah.
Instead, because it's probably not gonna help anyway, because if their tongue's swollen, you're not gonna be able to push it out of the way.
Yeah.
In something like that, we'd have to create an airway, cricoidotomy. Cut right there.
Like if somebody comes in because they're having an allergic reaction like that, you have to do the tracheotomy.
Cricoidotomy.
Correct.
Tracheotomy is more permanent opening, that's
Oh,
down
okay.
here. Cricoidotomy is the cricoid tissue that's right here, the cartilage.
Gotcha.
So if you'd feel where the Adam's apple is, that laryngeal cartilage is sticking out, and you just move your finger down just a little bit, you'll feel like a little soft spot.
Yeah.
Right
like
there.
a little divot.
Yeah,
Yeah, I feel
and
that.
it's really simple, you just get a scalpel, you just open up a little bit, and then you get some curved forceps and you go in this way, so it's tilted downward, and there's a little tube that just follows it right along. And now you've created an emergency airway.
Yeah.
But that's different from the more permanent one that goes from the trachea that's down here.
So what's the proper thing to do when somebody's having a seizure? Just let it phase out?
Yeah,
And just hold them flat.
well, yeah, because if their arms are flailing
Like
around,
they hurt themselves.
and you have that box of broken glass and barbed wire that you've been hanging on to for a while, yeah, you don't want them hurting themselves, or their heads bowing on the floor, you don't want them hurting themselves.
Yeah.
That doesn't mean you have to tackle them or stay on top of them. Some people say turn them on their side. Well,
I was
you
gonna
don't
ask that too,
really,
like
you
the
don't
head.
really have to, unless you see there's something in their mouth, or they throw up or something like
Yeah, I was
that.
gonna say, or
You don't really have to turn them on their side, and you always have to be careful about doing that. Because if a person's having a seizure because they fell from a height, or they had a seizure and
Gotcha.
fell from a height, they might have a neck injury. And
Yeah,
if you just suddenly turn them on their side, now you could paralyze them.
yeah,
So I never tell people just run up on somebody and suddenly turn them on their side. If you know how they got onto the ground, like if they gently got themselves in that position and started having a seizure, then it would be okay too, because their neck's gonna be fine. But you still sort of support their head in the process. But you don't have to do it. If you see stuff in their mouth, they throw up, well then yeah, you wanna turn them, so
And
they don't choke on
you
it.
can have seizures that go unnoticed, correct?
That would be like an absence seizure.
Oh, okay,
Yeah, a person will be watching the game, and then somebody like, wait, how did the Eagles get the ball again?
yeah, I know somebody who's had like a couple seizures recently and didn't know until there was that one bad one, and then he went to the hospital and.
Yeah.
Gotcha.
Yeah,
I see a lot of
absolutely.
seizures at my job, so that's why I asked.
Yeah, and you will. Most of the time, you don't do anything. Most of the time, they just work through it. And then they're gonna be wiped out, usually pretty tired afterwards. That's because their brain just used up a whole lot of energy. Not their arms falling around, their brain used up a whole lot of energy. Which means now it has to reset all of that, which takes energy to reset everything. So now it's like, best thing to do,
Sweet.
sleep.
Hmm.
Not you, them. Well, you can sleep too.
It's probably an exhausting experience to watch.
Yeah, oh, people who are unfamiliar freak out.
I freaked out every time.
She freaks out every time. Don't freak out
I
every
seen it
time.
3 times at my job,
Yeah.
just at work.
Yes, don't
Different
freak out.
people.
How,
I
Don't
was like,
freak
oh my
out.
gosh, they're gonna choke it.
Don't freak out. don't, because there's no reason to most of the time. But you can understand, looking back into history where we didn't have the understanding of medicine we have now, how that could be considered like a demonic invasion of the body.
Oh,
And
yeah.
the person was, under a
Possessed.
spell from witchcraft or something. Because if you couldn't explain it, you just made up another reason, a demon, a demonic reason, or a supernatural reason. If you've seen seizures enough, you say, okay, I see where they could have come up with that idea. But
I
most
always
of the
thought
time it's-
seizures was the brink of death because you wasn't getting oxygen to your brain.
No,
That's what
it's
I
not, it's not
thought.
about oxygen to the brain, it's about the brain sending out signals that are just sporadic and wrong.
So with epilepsy, is it right in saying that that's the one where sometimes the flashing lights trigger it?
That's what I heard.
No, other people who have seizure disorders for other reasons
Oh,
can
got it.
also have the same effect happen.
Okay.
But absolutely, we will say that flashing lights in some people can trigger
The epilepsy.
the seizure.
Gotcha.
It's not gonna
Because
trigger,
I've met like
it's not
some
gonna
people where
trigger
they're like, I
epilepsy,
can't
it's
go
gonna
in
trigger
clubs
seizure.
and I can't do that because of
Yeah,
the lights.
so people who do have epilepsy, that is gonna be a trigger for them. But
That's
also
what I was
people who have other seizure disorders
That could be a trigger for others
could
as
also
well.
be a trigger for them as well,
Okay,
yeah.
gotcha.
Alright.
What makes the flashing lights trigger the brain to like spaz out?
I don't know what the information overload is that causes it to happen. I don't know the connection between that. I just know that it does.
Yeah,
I'm just not well enough informed to understand
yeah, no.
how that affects the switches in the eyes, which affects the occipital lobe and how the brain interprets it. I honestly don't know.
Interesting.
I'm stupid that way, in a lot of ways, actually. Epilepsy, chronic fatigue mole, we talked about that.
Parkinson's?
Yeah, we're not gonna talk about Parkinson's too much. Parkinson's is a deficiency in dopamine in the brain, and maybe acetylcholine.
And that causes what? I just wanna make sure I'm good on it.
Instability in movements,
Okay,
that's why you see that shuffling gait.
yeah, that's all I think of it. Mine.
What's another good one you see a lot? Intention tremors, you see that a lot. Where the person knows to pick something up,
It's shaky.
and as they get closer to it, they shake even more.
Yeah,
It's called an intention tremor because the tremor happens because they're intending to do something.
yeah.
And as they get closer to it, the shaking gets worse.
Narcolepsy?
What's next?
Narcolepsy?
No, we're not gonna talk about narcolepsy. I'm not talking about narcolepsy. Spontaneously falling asleep during daytime hours. It's not the result of partying or being up all night or listening to my lecture. The brain just says time to sleep, goes to sleep. And you
Is
can
that
always
like
tell
what
the
happens-
difference. You can always tell the difference in a person when a student in class has narcolepsy versus they've been out partying all night. Sierra's over here, she's like dozing like this. And I go, Sierra, and she's like, I go, Sierra, she's like, I go, Sierra, she's like, yeah, go ahead, yes, the answer's 5. That's up all night partying. I see Sierra go like this, I go, Sierra, and she goes, yep. Comes right back like that, that's narcolepsy.
Um,
And you see how they recover quickly.